You want to watch this on dental health? Huh?
Hey, Pastor.
What's going on, boss? Yeah. All right. Hello, everyone. How you all doing?
Fine. Hello.
Hello,
Hello.
hello, hello, hello. All right. Good to hear. Good to see everybody. Good to see everybody. Welcome to our monthly Dental Health Academy, where we have an opportunity to hear from the dentist and also ask the dentist any questions that we may have. And so we want to thank Dr. Scott for being here today. Thank all of you all for being here today. And if you're watching on social media, on Facebook, YouTube, or Twitter, I invite you to share the post. Again, if you're watching on Facebook, YouTube, or Twitter, we invite you to share the post. All right, we're going to put it in the hands of our resident dentist, Dr. Kerwin Scott.
Hey, Pastor. Thank you. I appreciate it. How you doing today?
Doing good. Everything's going good.
Yeah, I hope everybody's blessed and had a good day. We getting ready to head into the weekend. Um, and so I'm always excited about the weekend. Okay. Pastor, can you make me a host so I can share my screen?
I definitely will. It is done.
All right. So I got an exciting topic I want to talk about, which I get a lot of questions about all the time, is dental implants. And there's a lot of information when it comes to dental implants that I can cover, but I'll just start with the basics. And then as we have more meetings together, I can go more and more into detail about implants because you see this progression. Well, I do. And I'm sure you do too, where you start off with teeth. You see a baby, they walk around with their teeth. You see adults, you walk around with your teeth. And then at some point, you might lose a tooth. And then now, if you lose a tooth or two, now what do? So if you go on Instagram or Facebook, you see people placing dental implants all the time. You see it online. You see people going and get smile makeovers in a day, or dentures supported by implants, or full mouth rehabs. They call it all different types of things. But what it comes down to is this progression of tooth loss over time, and then innovative ways to replace the teeth. Now, I do have a couple of slides in here that, might turn a stomach or two. But I tried to, pick stuff that wasn't really that bad. So, but just, if you see something you don't like, just, it's really nothing I can do because it's only one way I can show it is by showing you exactly what we do. And I think that that's really important to show. But if anybody has any questions at any time, please stop me. This is more of an open forum for discussion and not just me talking, because really what I want to do is share information and learn from y'all. I want y'all to learn from me, and and we can just move forward like that. So again, the title of it today is we're talking about implants, but I did want to take a second to talk to y'all about how teeth evolve from a baby all the way up to an adult. And so you can see in this picture, this is an old school picture, but you see these little tooth buds. These are all teeth, the different stages of tooth development. And you can see how the tooth starts to take shape. And then you can see this tooth poking through the gums. And then you see the tooth leaving the gums. So you see full circle, as we grow teeth and lose them. And I'll talk just a little bit more um, about the formation of teeth. So what you see here is, of course, a little baby tooth over here with a pacifier in here. But this X-ray is an example of tooth development. All these teeth that are poking out are baby teeth. At the very bottom down there, you see adult teeth forming. And what happens is these adult teeth push those baby teeth out. All these teeth are when you have a baby, all these teeth are in the baby's mouth, developing and growing from birth. Now, when you look at a human, our bodies are pretty much formed at birth. When a baby comes out, a healthy child, all of their limbs are there, their head, everything, their eyes, their ears, their toenails, their hair, everything is there. And it's pretty much formed. And it stays in that form as a baby grows. The only difference with a baby comes out with a big head and little arms and little legs. But over time, you see the legs and the arms and the stomach and the torso grow, and the head stays the same size. So the body grows a little bit different than teeth. So when a mother has a baby, she looks in the baby's mouth. You don't see anything in there but gums. You don't see any teeth in there, and so, but looks can be deceiving because inside those gums there are teeth that are forming. Typically, about 6 months old. At 6 months, you will start to see the baby teeth push through the gums. We call it teething, and the baby's crying and fussing. It's because those teeth are cutting through those gums at about 6 months. And so this X-ray I got up here is a child that's at least 6 years old. And the reason that I know that is because they have, at 6 years old, you get your first, some of your first adult teeth. And you start to see all the baby teeth. The baby teeth get loose and they go to school and they come home, Mama, Daddy, my tooth fell out. A lot of people put those teeth up under the pillow for the tooth fairy and sneak money in their baby's room while they sleep, and take the teeth and throw them away. So the reason that those teeth are loose is because there's an adult tooth growing under them, like you can see in this X-ray. And so, and in rare cases, you do see children who don't develop teeth at the same rate as other children. There are a lot of bone diseases. There are a lot of other diseases that can stop a child from growing teeth. And so if you look in your child's mouth and let's say they're 2 years old and you don't see big teeth in their mouth, those front teeth, take your child to the dentist. You should be taking your child to the dentist. The first time you see a tooth in their mouth, you should take them, because it's a really good indication of normal child development, depending on when the teeth come in. And they come in at different times. So a dentist will know what to expect when they look in a child's mouth based off their age. Now, another thing about baby teeth, they come in all different shades. Some babies' teeth might be white. We call them, I've heard people call them milk teeth. Some babies' teeth might be more purple, a little bit more purple. Just depends. That's more of a genetic thing. But as long as the teeth are there at the proper times, is a really good thing. And another thing to consider when you're looking at children's teeth or dealing with children's teeth, a lot of people believe that, God gave us 2 sets of teeth, so I'm not going to worry about this first set. And so you let your kids drink jungle juice. They walking around eating oatmeal pies and not brushing their teeth, eating candy. But what happens is those teeth get lost prematurely because they get cavities on them. And then you go to the dentist or your child tell you their teeth hurting, and you take them to the dentist and they take teeth out. Now, these teeth that God gave us, the first set, are space holders for your permanent teeth. So if you lose a baby tooth too early, the space might close, and now your permanent tooth, your adult tooth, can't push through the gums and come into the spot it's supposed to be in. It won't erupt correctly. And so you see, and I'm sure that there are some adults who have teeth that are in certain places that they shouldn't be. And a lot of times it's because those spaces get lost early. And so you have to really be careful about your children's teeth because you want them to develop and grow correctly. So now moving forward, this is a picture of adult teeth. These are adult teeth, but you still see the wisdom teeth here. You know, typically we take out wisdom teeth. I take out a lot of wisdom teeth out of children and young adults, just mainly because there isn't space for them. Through time, we've kind of, in the dental world, they say we've kind of evolved and our diet has changed. So we don't need to chew on as many back teeth because we eating more processed food, stuff like that. So these teeth, a lot of times they don't grow in, they grow in crooked and they put pressure on the other teeth. And they put, somebody got a question? Okay. And they put pressure on the bone. So a lot of times we will go ahead and take those teeth out. And so again, you see this natural progression of tooth loss. As you get your permanent teeth, as you age, you start to, you go through life, stuff happens, you stress, we work, our financial situations change, things happen. And a lot of times what you will see is you start off with cavities. It's this natural progression. You have a healthy tooth, and then you don't brush your teeth. A lot of plaque and tartar sticks on your teeth. And what that really is bacteria eating away at your teeth. And then over time, when that bacteria sits on your teeth with that plaque, guess what? You're going to get a cavity. In worst case scenario, you will lose your tooth. A lot of people have, and I'll talk about this a little bit more in depth, get crowns on their teeth, or they get root canals on their teeth because they at home on the weekend, their tooth blows up on them, their cheeks swell up and they in pain. So they go into the doctor and the doctor takes the nerve out the tooth. Or some people just say, forget it, just take the tooth out. And so you see this natural progression of stuff that leads to tooth loss. And really the bigger point is, once you have an issue with your tooth, once that dentist goes in there and works on your tooth, it'll never be the same. So, and depending on who you go to, that's what, and that's one of the main points, that I always talk about when we meet for Dental Academy is, really be informed about what the doctors are doing to you. Ask questions, take pictures of your x-rays, make them explain stuff to you. You should never walk in and walk out and have a treatment done and not know what happened or know what it looks like or what to expect or know what the person is going to do before they actually do it. Because a lot of times you go into people's offices and they're moving fast. They're trying to get to the next room or they got 10 patients in there at one time. So you need to slow that person down and make sure you get informed about where you're at, your health, and the procedure that's going to happen. Because once you drill on a tooth or once you take a tooth out, it starts to not only affect that tooth, but other teeth. And then you see this progression of lost teeth over time. And especially if it happens in a child, because African-American children, by the time they turn 18, have already lost 5 to 8 teeth, which is a lot of teeth to lose before you even turn 18. That's a lot of teeth to lose for a young child. Causes all kind of digestive issues, self-esteem issues, biting issues, the jaws in your face. It puts a lot of pressure and makes a lot of changes, unnecessary changes in your body by just not brushing your teeth or seeing a dentist regularly. So make sure that you take care of that. Now, with older people, You see typically have yellow teeth. Older people teeth are a little bit yellower, they worn down, they not as tall. That's typically how it is. But nowadays with dentures and stuff like that, you starting to see a lot of older people with whiter teeth because everybody wants whiter teeth. I've seen several patients who are in their 80s and 90s who are getting braces. You would think of braces are for kids, not anymore. People are living longer. People want white teeth. People want straight teeth. So people are getting dental work done up into their 80s and 90s. So never think you're too old to get some dental work done. And if you have any questions, you can ask me or go to your dentist. So just moving right along here. So I wanted to know how much does it cost in Florida without insurance to fix a cavity? And what I found was it's anywhere between $200 and $600 without insurance, which is a lot to fill, just to fill a tooth. Uh, and typically what you see is a lot of people had the silver filling, which the technical name for it is called amalgam. And then some people have the white filling, the clear filling, which is on the bottom there, where you can't tell that there's a filling there, but it's one there. And so typically as a general dentist would be one of these types of fillings in your teeth. Now these fillings, they cut your tooth away and put these fillings in there, but it weakens your tooth when we have to go in and do that. So as you get older, sometimes you don't have any issues, but a lot of times you have reoccurring issues with these teeth. And it's mainly because they get cut on and they have cavity and decay in them. Does anybody have any questions about anything? I know I'm just talking and talking and talking.
No, Scott. Go ahead.
No, Rib, I was just going to tell him I'm very familiar with those silver fillings. That was the VA. That was not the VA, but that was the military was using back in 1979 when I went in the military. This is the stuff they was using. But the only thing about it was real durable. But later on in life, when I had problems, it was real problems with my teeth from that type of stuff they used. I don't know whether it was cheaper to do that or whatever they did, but I remember that particular feeling right there, that silver one. Mm-hmm. But now, I just thank God that I have dental with the VA because I'm 100%. But before I got my 100%, I needed one filled, and it was like $230, and I dealt with a lot of pain because I couldn't afford to get it done. So you right on point, and that been a while back. I don't know what it is now, but I remember those days.
Yeah, and typically, what I didn't say about that material, this amalgam material, it is one of the strongest materials. But what happens with this material over time, it expands. It never stops expanding. And which makes it and on one side a really good material, but then on the other side, a lot of times you see it's very brittle, the material. So over time it will fracture, and if it fractures, you won't know it right away. By the time you figured out that it's fractured, you got bacteria and stuff already down in the tooth. Which kind of leads me to my next point. Is what if you get a cavity and bacteria gets down in there after you've already got a cavity on it? We could either go back in. Sometimes what we'll try to do first, if your tooth gets sick, after you have a filling, we'll go in and put a crown on it. We'll say, yeah, you got to get a crown. So you come in, you get the crown. Sometimes we'll do veneers. Veneers are typically somewhat for cavities, but more so for staining and stuff like that. It's really has a lot to do with aesthetics too when we do veneers. Or we'll do a bridge. If you lose the tooth, we'll put a bridge in there. But you can see in that picture, in order for us to put a bridge in there, we gotta cut down 2 healthy teeth to put the bridge in. So now you trying to cover up that one lost tooth that you lost, and then you compromising 2 more teeth to put the bridge in. Now, sometimes bridges last a long time, 20, 30, 40 years. I see patients who've had bridges for 30, 40 years, and they have no issues. But in some people, those bridges will fail over time, And if they fail, now we got to take out those other two teeth. And that's where kind of dentistry has kind of grown. The things that we can do has kind of changed. We have a lot more ways to treat tooth loss. And so this is more just about a root canal. A lot of times, if you get the crown, you have the cavity, you get the crown, the tooth still gets infected over time. So now we got to go in there and do a root canal. We got to take the nerve out the tooth. If we have to take the nerve because it blows up on you, it always happens at the worst time. It don't never happen when you're sitting in a dentist office. It happens when you on a vacation or at home on the weekend. And a lot of times people go to the emergency room. Dental pain is the number one reason why people go to the emergency room. And you go to the emergency room, pay all that money, and it was a tooth that needed a root canal. So typically what we'll do, they'll go in and take the nerve out the tooth and put some filling in there and then put another crown on top of the tooth. So now you can't really do anything else to the tooth. You had a cavity, you had it filled, then you went and had a crown put on it. That didn't work. Then you went and had a root canal done with another crown put on it. And then in between time, you probably develop periodontal disease, which I've talked about in previous meetings. We've talked a lot about periodontal disease. Periodontal disease is just bone loss in the mouth, which eventually will make your teeth loose and cause tooth loss. And there's other links to other systemic diseases that are associated with periodontal disease. And that's typically what I do on a daily basis. I treat patients who have periodontal disease because those same patients who have periodontal disease typically have diabetes or some type of heart disease or some kind of bone disease like osteoporosis, like women who've gone through menopause and are post-menopause have osteoporosis, or people who have issues with their bite, have lost a lot of teeth, and they have bite collapse and stuff like that. So I see a lot of patients like that every day. And so I didn't give you a warning, but this is what happens with a root canal tooth. This tooth that you see here that's broken down had a root canal done to it. And so over time, what happens is it broke down. And so now you come into the doctor, you're like, man, I was eating a piece of bread or a piece of candy and my tooth broke off. So now we got to take the tooth out. So I take the tooth out, as you can see from left to right. And then if you look down here in the bottom left corner, this little stuff you see, these little granules is called bone graft. So now the standard of care is we typically try not to take a tooth out and don't put bone graft in there. The reason we use bone graft is to preserve the space, because if you don't put anything in there, that your bone, when we take that tooth out, all that bone that was around your tooth will go away and leave a big concavity there. And then if you try to come back and get some type of treatment or dentures at a later time, you don't have enough bone in your mouth. And that's why you see a lot of older people who have their teeth taken out. It looks like their lips are real big. They got a lot of lines on their face and their eyes look kind of sunken. It's because you've lost that bone in your jaw. And it mainly happens in a person who doesn't have periodontal disease when we take out teeth. And then typically, so now what we do is put that bone graft in there, which holds the space. And it allows your body time to heal, and it turns that bone graft material that we put in there, it turns it into your natural bone over time. And so then this last picture you see down here is what we do is put a membrane over the top. We put a little covering over the top to protect it. And then we put stitches in it. And the reason we do that is because this site where that tooth was, I'm preparing it to get an implant. But if I don't do this, there won't be enough bone to put an implant in there. So we got to preserve the bone. Anybody have any questions about anything? Okay. So, again, just to, I'm saying the same thing, but I say it a different way. A lot of sugar in your diet, we know causes diabetes. Some people call diabetes sugar. You see people who eat a lot and drink a lot of foods and drinks that have sugar in them, allow the proliferation of bacteria. Bacteria then turn those sweets into acid. That acid gets on your teeth and causes decay. And that's what starts the cycle that I'm talking about today, from all the way from a cavity to having your tooth taken out. And so, just a little bit more about periodontal disease that I mentioned earlier. Everybody starts off with healthy gums. Then you go through gingivitis. Gingivitis is when your gums get swole up. You brush your teeth. Sometimes you have pain with brushing. Sometimes, when you floss, you have pain, and you see bleeding. And so that's gingivitis. If you don't go to the dentist and get treatment, you start to develop periodontitis. And you can see in these pictures how the bone and the gums kind of move away from the teeth. And then in return, what happens is you lose bone and it makes your teeth loose. And then you become more susceptible to tooth loss. Anybody have any questions about anything?
Yeah, Dr. Scott. Yeah, and even though that I could get treatment, I take these workshops at heart because I spread the good news. And the reason I say that because I notice some people that chew gum all the time and have the yuck mouth or whatever. I don't know them big names you talking about with the gums and all, but what you saying is that chewing gum that you chewing all the time is not good for you because of the sugar that's in it. It might kill, a little scent at the moment, but the more you chewing, because you can tell when people kind of dealing with some type of, issue with their mouth because they always chewing gum all the time. And that sugar is my point. What I'm going, this is not, jugging at nobody, but I heard something you said about that sugar can cause more problems than you addressing the issue. That's basically what I'm saying.
Yeah. Now, that's a really good point because a lot of people who take a lot of medications suffer from dry mouth. Some people might have a syndrome called Sjogren's syndrome, which it causes dry mouth. It can be in any age. It causes dry mouth and it causes dry eyes. So those are two things that people deal with. And that might be a reason why you see people sucking on mints all the time or chewing gum. Now, one thing about chewing gum is if you chew sugar-free gum has a sugar in it called xylitol. Xylitol is a really good sugar because bacteria can't break down xylitol. So if you do have, so sugar-free gums are really good to chew, especially if you do have sugar and you chew some sugar-free gum, it makes it harder for bacteria to break down sugars in your mouth. So sugar-free gum is okay. It's just all the other gums with just straight sucrose in them or fructose or whatever other types of sugars that could be harmful to your teeth. But a lot of people do suffer from mouth dryness for various reasons. So you will see people chewing, sucking on mints all the time, especially older people, or chewing gum, trying to keep their mouth wet, or people drink a lot of water. But then I just thought of this. People who drink a lot of bottled water, they're not getting that fluoride. If you live in a city, a major city, a lot of people live out in the country, drink well water. People who drink well water don't get a lot of the fluoride they need, which makes them more susceptible to cavities. It puts them in a category with people who have dry mouth all the time. They are more susceptible to cavities because your mouth is dry, and it creates this environment where bacteria can really grow fast. So people who don't drink water with fluoridated water, and people who have dry mouth are more susceptible to cavities. If you do have dry mouth all the time, they have saliva substitutes that you can use, or just make sure that you just really maintain and brush and take care of your teeth.
Thank you.
And so this is another case that I had, and people come in like this all the time. A lot of times I'm showing y'all single tooth stuff, but a lot of people come in, I have to take out, people have 10, 20 teeth in their mouth, and I have to take out all of their teeth because they've gotten so bad that with cavities and stuff like that. You could even see in this picture, all of this person's teeth, you see they got that silver filling in there. And this is a person, if you have silver fillings in your teeth, you going to the dentist. But just because of the nature of cutting on teeth and, not really brushing and managing your teeth and taking care of them, you're going to lose them. Um, and so you see this tooth up here don't have any bone around it. When I pushed the gums back, it didn't have anything around it. It was just a tooth just sitting there. And so in situations like that, you have to take the tooth. I have to take it out. And so you can see how, first off, how big the roots were on the tooth. And you can see the socket that it came out of. Look at, and when you think about that, just think if somebody took a portion of your kneecap off or some of your leg off, had to take that much off. That's a lot of damage to your bone in your jaw. That's a lot of bone loss for your jaw. That's very significant. And so, a lot of times now, like I said before, what we're going to try to do is try to save that area. We're going to try to maintain that bone so it doesn't go away, because right above your upper teeth, you have your sinuses. You got your nose and you have your sinuses. A lot of times these teeth are in the sinus. So if you lose the bone that separates your mouth from your sinus, you're going to have some serious issues. And
Dr.
so,
Scott,
uh-huh.
got a couple questions on Facebook. One
Okay.
question says, "Do you have to floss every day?"
Yes,
And
you
then
should
the, and then
floss.
the,
Yeah, every
so
day.
what's your answer?
You should floss every day, at least once a day.
Okay. Then the other question is, what should you do to get the fluoride? So if you don't have the water with the fluoride, what should you do to get the fluoride?
A lot of times you can go into your grocery store just and buy toothpaste that has fluoride in it. You can also use mouth rinse that has fluoride in it. Um, there's other you can also buy fluoride strips. You can buy fluoride tablets. There's a lot of other um, fluoride products that you can use to supplement if you do live out in the area where they don't have fluoridated water.
All right. That's all the questions.
Okay. And so you see the same thing here. And basically, what I had to do again was take the tooth out. Now you see all these silver amalgams in here. These other two teeth, I guarantee you, over time, gonna need to come out. Over time, it might be 10 years, it might be 5 years, 5, 10, 15 years, but eventually, because of the loss around the teeth, if the person doesn't improve their oral hygiene, those teeth gonna have to come out too. So again, I put bone graft in there and I covered it up. Now this picture all the way to the right is just a 2 week heal, and that's how it looks after it heals, after it starts to heal. Um, and one thing I will say, a lot of patients when I do this, they look in their mouth and see it looks like that. That looks like it's infected. And so what a lot of people will do is go to the emergency room. Why they go to the emergency room, I don't know. They won't call back, call back to the doctor that if you have a question, call back and talk to that doctor specifically. Don't go to the emergency room because they're not trained. They don't even know uh, what the dentist did a lot of times, unless there's a dentist there on staff at the hospital. So don't go to the emergency room unless it's an emergency. So now, since we've kind of gone through, somebody had a question. Okay. Now we've kind now we've kind of gone through what can happen if you don't brush. You get the cavities, root canals, um, um, tooth extraction. We do bone graft. Now, we what we do is place implants. That's what I do is place implants. So after I see a person, I typically won't see a person until they need to get the tooth taken out. That's typically when I'll see them, or a person who has periodontal disease, and eventually I have to remove teeth. So now we kind of getting into implants. And this is just a picture of implants. There's so many different types of implants. And one thing I want to say to people who are considering getting implants or people who already have implants, make sure that you talk in depth to whoever's going to place the implant about what type of implant it is. Because I see a lot of patients who come in, they get implants placed, and um, Nobody knows what the type is. You can't put a crown on the tooth if you don't on the implant if you don't know what type of implant it is. So a lot of people get their implants taken out just mainly because the person doesn't know what type of implant it is. That's crazy. And not to mention implants can be very expensive. And another thing, you see this implant over here, this white implant. Some people have titanium allergies. I haven't seen it. Some people believe that they have titanium allergies, which is very rare. But they do make an implant for people who believe they have titanium allergies, um, which is that white implant there. But this is a case that I did. So remember, I said you take the tooth out, you put the bone graft material in there, you let it heal. And this is how they return. This image on the far left is how they return. The gums look nice and pink, and it's bone graft in there, and it's ready for implant placement. So the first thing I do is open up the gums, and then I use the implant drills to drill a hole in the bone. It's like drilling a hole in the wall at home. A little bit different because there's other stuff there. You got to be careful, but it's similar to that. And so you see, I just drill a hole in the bone, and then I place the implant. Now, typically, there are a lot of considerations that go into me putting this little hole in your bone. It is when it comes down to it, that's what I'm doing. But there's just so many considerations that you have to make when you get ready to place an implant. And then you see in this picture on the far right, we put a little covering screw over the top because I want your gums to heal around that screw. If your gums heal around that screw, after about 3 or 4 months, you will be ready to get the crown on it. And then I will take that little piece off, and your general dentist will screw a crown on there for you.
Dr. Scott,
Uh-huh.
I ain't want to cut you off because if I
No,
don't
no.
get you, I'm gonna forget what I wanted to ask you when you said about like a wall. Let's use a stud in a wall, right?
Uh-huh.
Okay. Now when you dealing with a gum, so you what would be your stud in this gum for nerves? What basically I'm just replacing the stud for a nerve. Because when you going in that bone, there's a lot of nerves there. Do you have you got a stud finder? Do you got a nerve finder?
Yeah, we use X-rays. Yeah, we use X-rays to locate the nerves.
Okay,
Yeah,
okay,
we.
because
Mhm.
yeah, but because I was just curious about that because it's so many nerves and you can easily make a mistake if you don't know what you're doing. And a lot of times, like people come to you as cause somebody that made some type of mistake. I know you run across those cases. You know what I'm saying?
Yeah.
So
Hmm.
that is real serious stuff, man. Because I've had I get injections in my back,
Uh-huh.
and if touch with that needle, that long needle, and hit one of these screws in my back, I scream, but I can't move. And I
Hmm.
know how delicate it is when you're talking about nerves. I mean, I scream so loud, but I can't move because it's a look feel like a foot, a doggone needle in my back. So I
Yeah.
understand how important it is when you bump a nerve.
Yeah. And nerves control your muscles. So if you damage a nerve, if I'm doing a surgery on somebody and I damage a nerve, they're gonna lose function somewhere. Their lip, their eyelid may not open. They may not be able to move one side of their face. So that's why you bring up a good point. Whoever you are letting do surgeries on you, you need to make sure that they're qualified to do the surgeries. Make sure that they have additional training. Make sure that they can answer your questions. What nerves are over there? If you people should be able to tell you what nerves and what blood vessels and all that stuff is there. That stuff should just roll off the tongue. Because you get the extra training, what's there, how to read x-rays, you can share this information with the person that you might be treating. So that's a really good question. But yeah, there are a lot of things that we need to do to really safely place an implant or multiple implants. It just depends. It depends on where it's at and what's getting done. But we typically use 3D X-rays, which is the new standard of care. You used to take the X-ray, they put the film in your mouth and take one X-ray. We use those too, but for surgery, the standard of care is to get a 3D cone beam X-ray like you get in the hospital.
Hey man, and
So
one more question.
Yeah.
Don't what I'll finish say. Those X-rays. The reason why I say they are so important and slip up. I had a kidney transplant, and they
Mhm.
wasn't thorough with it, and that's why right now that I ask a lot of questions, even at physical therapy. I asked the man today. I say, man, am I asking you too many questions? He said, no, you curious. I know we just working the machine, but what I'm getting on this here for? What I'm doing is because I had a mistake happen to me. I was having a
Yeah.
kidney transplant, and they cut my urethra.
Mm-hmm.
And I had so much pain till I would just pass out with pain because they couldn't figure out where I was bleeding from. But I know
Yeah.
how it is important to ask questions. That's my main thing. Ask questions. Because if they can't answer them, then you might need to, get some other opinions because it ain't nothing wrong with asking a whole bunch of questions because just,
Mm-hmm.
okay, what? And another thing, if you go have somebody under anesthesia,
Mm-hmm.
you hear the nerve, they unconscious.
Yeah.
When they come to, how would you know you made a mistake?
Typically, you would know right then and there. Because we take X-rays throughout the procedures, so we
Okay.
can always know where we're at. Now, if a situation does happen where a nerve gets damaged, or any type, because typically, if a nerve gets damaged, you're gonna have a bleed. You're gonna have some
That makes sense.
uncontrollable bleeding. So, first thing you got to do is stabilize the patient. It comes with training. There's been times where you might have a medical emergency. I might have to step in and do something to help the patient. But typically, what I'll do is I tell people if there's a complication, I try to let the patient know on the front end. Hey, I'm working in this area. This could happen. This could happen. Typically, you will see it in your consent form. And so when you come into an office, you should always sign a consent form. They should always be telling you what some of the possible complications associated with whatever procedure you're doing. But when people do that, that opens up the door for you to ask questions. Well, what happens, like you asked? What happens if this happens? What would you do if this happens? Would you tell me? Would you just let me walk out the door and not say anything? What are the possibilities of this happening? All that kind of stuff. But typically for me, if something happens, I'll tell them right away and I'll manage them. Some people I need to bring in the day after I do a surgery. Some people I can bring them back a week. Some people are better at 2 weeks. I typically, if I do a surgery on somebody, I'll always call them that night and check on them. And I
That,
ask
that,
questions to
yeah,
try to understand where
that's
they're at.
that's good stuff, man. Because you the time when you have surgery, I'm gonna let you go because I'm asking too much. But anyway,
No, go
I've
ahead.
noticed that when you go to have surgery, when you
Mhm.
fill the consent forms out, that be the front desk and the nurses. You the
Yeah.
time the surgeon, you don't even get to. So what I like what you're doing because you're a surgeon and you coming and meeting people where they are, but you the time you don't even see the surgeon. If you got any questions, you ask the nurse and she bot don't know. You just signing papers. And then when they
Yeah.
get to the surgeon, they're in another room waiting when they roll you in there. So that's good that you have that conversation with your patients. You know what I'm saying? Because that means a lot, man. Because you the time when you sign consent forms, you don't even talk with the doctor. You might
Hmm.
talk to them before the surgery briefly, but them 20 papers you just signed, you it's covering everything if something go wrong, and you never even ask what could. So that's
Yeah.
good, doc, that you do that.
Yeah. I appreciate that. Yeah. It covers them, but not you.
Right.
So, Dr. Scott, on that
Uh-huh.
third picture where that implant is down in there.
Hmm.
So when you put the crown, when you attach the crown to the implant, let's say something happens and the crown broke.
Yeah.
Do you have to? Can you attach a new crown to that same implant, or do you have to screw that implant out?
That's
Oh,
a good
that's a
point.
good question.
That's a good question, Pastor. A lot of times, what we see is, and it depends on, you got to know your implant systems. First off, you need to know the person who you work with, the patient, because you have to be able to kind of foresee future issues. But typically, what I see is the screw will break. A person to be biting down
Okay.
on the crown, and the implant screw because that implant has on the inside of that implant, and you probably can't see it, but there's connections on the inside of that implant. And so what we do is we'll screw down an abutment. An abutment is the piece that the crown actually sit on. So an implant really is three pieces. It's the implant itself, the abutment, and then the crown that you chew on. And so all of those pieces screw down in there. But in the situation where the crown breaks off, you typically will see the screw broke inside the
Okay.
implant, and then we'll go in and take the screw out. Sometimes the implant itself will fracture, but that's why I made the comment. You got to know who you're dealing with, because if you have a patient who clenches and grinds their teeth at night, I probably won't want to put an implant in their mouth until we address that issue, because they're gonna break it off. And if that implant gets damaged, you can't just put another crown on it. I have to go in and drill your bone out and remove that implant. And I do it a lot. A lot of people get implants, and they go some places, and some people doctors put implants in, and they're not in the correct position. Sometimes they grind their teeth at night for various reasons. The implants become infected, and then I have to go in and take them out. But typically, if the crown breaks off, it's usually the screw. But there are times when the implant itself fractures, and I have to go in and take it out. Did that answer your question, Pastor?
Yes, sir.
Okay. And so just moving right along here. So I know I spent some time talking about just single implants, like if one tooth come out and we place the implant. But what about people who have all their teeth that fall out? A lot of times people think, I get patients all the time that come in, I didn't think I could get teeth because I don't have any bone in my mouth left. And so I wanted to show y'all, these are two cases that I did where I placed all these implants in. Now, this person over here on the left had a lot of teeth that I had to take out, but they were all diseased, bad teeth. And so I had to take them out. And I don't know if you will be able to see this. Can y'all see my cursor?
Yes.
This little dark line right here, if you can see that, it's on both sides.
Yes.
That's one of your major nerves running through your jaw. And so a lot of times when we place these implants, we have to make sure that I identify this nerve. Sometimes I'll go in and expose it so I can see it. So I make sure that I don't drill an implant into the nerve. So you need, when you're getting implants placed on your bottom jaw, make sure that you have a really good conversation with them about their plan to place implants, because a lot of times you can drill into that nerve and then you'll lose all your muscle function all the way up to your eyelids if that nerve gets damaged. So you got to really be careful with that. Now, this patient on the right, if you can see my cursor over here, they lost a lot of bone. This person actually is a young person that has some systemic issues. They were born where their hypothalamus didn't work. So a lot of like the hormones that a child needs for growth, for bone growth and development, this child didn't get it. This person over here on the right is 30 years old. And you can see, look where that nerve is. You can see the difference on the bottom jaw, how much bone is on the left side versus the right side. The one on the right side over here where I have the cursor, they don't have any bone. And their nerve is just sitting right on top of their gums. So when I saw this patient, it was very difficult you have to just be careful. You just have to plan where you're going to put the implants to make sure that you can do it safely. For patients who lose teeth, this is what we do. We place multiple implants, and then what we do is we can snap dentures into the implants. And it makes it really stable, because if you wear dentures, for people who wear dentures, the top denture is okay because you got your palate. The palate will, you get some suction with that top denture, but that bottom denture it moves around and flops around because you lose bone, and no matter how hard we try, to never fit correctly. So now what a lot of people do is they come in to see me. I'll place implants, or see a surgeon and they place implants, and then we snap the denture down on top of them. So this is typically what you do.
Let me ask a question. And I don't know if it was a dentist or not, but you were talking about bones and jaws. So when I was in the 9th grade, and I don't know why it was done, and I'm assuming a dentist did it, but maybe a doctor. I don't know. But I had to get a portion. It was less than a half of an inch, but a portion of my bone, like right where my finger is, taken out of my jaw. And for years, I could still feel the gap. Now it's all grown back, but I could still feel the gap to where that portion was removed. Was that a dentist that did that?
Yeah, probably.
Why do you think he did that?
Maybe because there was a fracture, or it broken off, or there was some type of infection. You probably could have had. How old were you?
In ninth grade. Now, it might have happened from football. I'm not sure.
Yeah.
But something happened. I got injured, but then they went and took a piece of my bone out, and I could feel that gap for years.
Yeah. A lot of times, like if you have trauma, it can cause you to get a what we would call you can get like a bone lesion, or you can get like we call them like odontomas. We got all kind of technical names for them, but it's a bruise to the bone, which causes sometimes the bone to kind of grow in a weird way. Or sometimes you get a lesion inside the bone. And so we have to go in and take it out. I see a lot of patients who have, we call them odontomas, or, other fibromas, other diseases or issues from trauma, where it causes the bone to grow crazy, like a keloid on your skin. You injure your skin and it grows, you get that keloid. Same thing happens in your bone. We call it dysplasia, but because the bone grows weird, it doesn't grow normally. And then sometimes in an effort to save your teeth, I'm sure as a young man, we have to go in and remove whatever that problem is to save the teeth. And so sometimes it sounds like they might have left a little bit of divot in your bone, but they probably did it to save your other teeth and to save your jaw.
Oh, okay.
Because over time, those lesions grow. And they'll keep growing and growing. Sometimes you might get a cyst in your around your bone that might grow in your gums, and then what happens is it puts pressure on your bone. Pressure will resorb and cause bone loss. So a lot of times what we'll do is we'll go in and remove whatever the issue is to save you from losing your jaw or the teeth around it.
Oh wow! There's a question on Facebook where. Actually, she sits on the other side of the church from you. She says, "Are you in Gainesville? Can I get a number?" And so Betty, he actually sits on the other side of the church from you. You sit on the left side, he sit on the right side. Both of y'all kind of in the middle.
We need to meet. We can meet in the back. I'll put my I didn't put a card up here this time, but I don't have a. I can put my.
I'll introduce y'all in church.
Yeah, that'll work. And from here on out, I'll make sure I put a card up in the corner so people can have the number to the office to call. But like treatments like this, now this is 1, 2, 3, 4, about 10 implants, anywhere, 10 to 12 implants. This is a probably at University of Florida, we charge $1,000 for implants. If you go out in the community, typically you see about $2,000 to $3,000 for an implant. So this treatment that this person is getting with dentures and all the stuff, probably about a $20,000, $30,000 treatment on both sides. This one on the right side is a little bit more because I had to go in and do sinus lifts. You probably won't be able to see it, but you can see this little white on top of the implants. Yeah. You can see it on both sides, that little white. I had to go in and do a sinus. I had to go into his sinuses and lift his sinuses up and graft. Because he had lost so much bone, I had to go in there and lift his sinuses up and put bone graft in there so I could place implants. So sometimes there's other procedures that I won't, that's I could spend a whole hour talking about just sinus lifts. But that's one thing that we do in order to place implants because it gives us vertical height, which we need to place long implants.
Since you opened the thing, I want to ask a question about. I hear people talking about sinuses, but I don't understand what it is. They just saying that their sinus give them a problem. They get like sick for days. But before you answer that, somebody on here says if the jawbone is steady shifting as you grow older, how would that affect the crown or implants?
If the jaw shifts as you get older,
If the jawbone is steadily shifting as you grow older, how would that affect the crown or implants that they already have?
so, okay. So it sounds like what they're asking is as the bone thins out over time, you get older, bone thins out, and all this stuff. Now, typically, what you see is if you still have teeth, or we put an implant in there, you typically won't have bone loss. The bone won't shift because bone won't resorb if you as long as it's biting. Your teeth are biting, or you got something there that's stimulating bone to turn over. Because what happens is bone is constantly, your body's constantly growing new bone. Like skin, if you cut a piece of your skin off, your skin will grow back. If you open the gums up, your gums, if you get a sore on your mouth, your gums will grow back. Our body, we can heal ourselves. And so typically what you see in the mouth, if you still have teeth or implants that are healthy, your body will regrow bone around those implants. And so these implants are treated with a specific type of material on the surface of them that stimulate integration into the bone. So these implants, yeah, we screw them down into the bone, but your body integrates and grows new bone around the implants over time.
Oh,
And it's through like cell differentiation. It's a whole process. We call it bone remodeling. And so as long as you keep your mouth healthy, your bone will constantly turn over and create new bone. And you won't really have that bone loss or significant bone loss. Now, on the flip side, if you have an implant and it's not placed right, or you're not taking care of the implant, you see bone loss around implants. And then what happens is the bone loss becomes so severe around implants, or in your mouth, you will lose teeth and you will lose the implant because there won't be enough bone around the implant to support it. And then you think about it, the implant is made of titanium. So a tooth has a nerve in it, has blood vessels in it, has your lymphatic system in it. And so a tooth is able to cleanse itself, but and help stimulate bone growth. But an implant can't do that. An implant is just a piece of metal. So if you don't keep your gums healthy around the implant, your gums will get swollen. And then over time, as your gums get swollen, more bacteria will come there. Your body will try to fight off the bacteria, and those two things together cause bone loss around that implant. And then if you lose so much bone, the implant it'll have to get taken out. Or sometimes we can regenerate bone. There are some instances where we can grow bone, and we can grow tissue. So it just depends on how severe the situation is. And so what I wanted to do, and this is, and you can take a picture of this scan bar, but there is a website. It's a ITI. This is a organization that I'm a part of, and it's a bunch of dentists who basically continue their education in implant placement. These are a group of people, and it's thousands of surgeons in this organization. And what they do is they compile information about implants. As we learn more about implants and learn more about patients and learn more about some of the risks associated with placing implants, they created a website where you can go and learn more about implants, because there are a lot of considerations that need to happen when you place implants. Now, I won't go through, I do want to show y'all this, and I'll be quick. But there are a lot of factors that you need to think about when placing implants. Now,
and I put it in the chat for you.
You put it in there? Okay.
I put that site in the chat for you.
Okay, thank you. Oh man, it would be doing this. Now I've been to this website 1,000 times. All right, let's see if it'll let me log in. Sign in. Okay, remind me later. And I won't take up too much time. So I just want y'all to see this because you really got to understand how much it takes to place an implant. So, like I said, this is just a website, and we use this website. SAC means straightforward, A means advanced, and C means complex. So we categorize implant placement. Some people have high aesthetic um, um, demand. Some people just need to chew. It all depends on where the implant is placed. So whoever your surgeon is placing the implant, they should be asking themselves all these questions. Can y'all see this? Can you see this, Pastor?
Yes. Yes.
Okay, so I'm gonna click on surgical and prosthodontic. So is it a single tooth? Yeah. So I'm just gonna click through these quick. Is it in the anterior or posterior? Is it in the front or the back? Is the person healthy or unhealthy? Do they have compromised healing? Are they healthy? Are they healthy, able to undergo? They ask all these different questions that a surgeon should be asking themselves when getting ready to place an implant. And really, you can ask the surgeon, hey, are you familiar with the ITI? And see what they say. They may or may not be. And that doesn't mean that they're not a good surgeon, but you definitely want somebody who's up on their game, learning new techniques and learning things. So is the person getting radiation treatment? What's their growth status? Are they a young child or are they an adult? Typically, we don't place implants in children. You have to have gone through puberty before we'll place an implant. There are some circumstances, children who are disabled, a lot of children with Down syndrome, other systemic or genetic diseases. Sometimes we will make an exception because they need to be able to eat, but that's a whole nother story. So what's their growth status? Are they complete? Do they smoke? People who smoke are more susceptible to implant failure. Oral hygiene, is it good, fair, poor, whatever? How is their compliance? Do they show up for their appointments on time? Do they comply with the suggested and recommended treatments? Do they take good care of their teeth? What are the patient's expectations? Are they realistic? Are they high, unachievable, or unrealistic? All these things matter because if I get a patient in the chair and they have unreal expectations, it probably wouldn't be smart for me to try to do anything that's not predictable. So, some people are willing to take more chances than others. These are the things that a surgeon should be talking to their patient about. Periodontal disease. Do they have periodontitis? Is there adequate access? Some people can't open their mouth wide. If you can't open your mouth wide, you might not want to get implants because it compromises the position of the implant because we can't get to certain spots to place them. Do they have pathology? I know, Pastor, you talked about having, something going on with your bone in your mouth. Typically, if people have pathology and issues, we won't place implants. Do they have previous surgeries planned, or have there been previous surgeries in that site? Look at that picture. So if I see a patient that comes in like this, I'm not gonna want to treat right away. I'm gonna want to figure out what happened here. Previously, what surgeries were done here. I want things to be as predictable as possible. So when I come to you and say, hey, this is what I think we should do, I would have thought about every single thing that I could possibly think about before I do it, because the more things that I can talk to you about as the patient, the more predictable the procedure comes. So let's say no previous procedures. What type of placement are we going to do? That's more of a, sometimes we can place implants right away. We could take the tooth out and place the implant right away. Sometimes we need to wait if there's an infection there, all these different things. Or what type of placement are we going to do, simultaneous, or are we going to stage it out? That's another question we need to ask ourselves. How much tissue is there? Is there a lot of tissue or is there not? What kind of quality is it? There are a lot of scars there, all this kind of stuff. So you can see, this is something that I'm going through quick, but when somebody sits you in a chair and tell you that they're going to place implants, and I haven't even clicked through I'm not even going to go through this. Look, it just goes on and on. Recession, attachment, different values. Is there space to put a crown there? All the different spaces that needed, the volume that's needed to place a tooth. Is there aesthetic value? How do they have a gummy smile? All these types of things. Do they have long teeth? What's the shape of their teeth that they have there? All these different factors play into um, implant placement. And so I'm speeding through. It's at least 20, 30 different things. And these are all things that I consider every time I place an implant. But what I want y'all to see is the actual chart that comes up. So it gives you a reading. It tells me, is this going to be uh, complicated? What are the aesthetic factors? What are some of the issues I might face? It gives me more information about the patient. It just gives me more information about the procedure as a whole. So, I wanted, this really isn't something that as a patient you would necessarily be concerned about, because there are a lot of things on there you don't understand. But I showed you that just so you could kind of have an understanding of how much goes into even placing one implant, let alone trying to place 10, 12 implants. So when you see your surgeon, make sure that they know some of this stuff. Ask them, ask them about different things, or what to expect, and they should be able to tell you this information, especially as minorities. A lot of times we afraid to ask questions. We defensive when we go to the dentist. We might have issues where we ashamed of the condition of our mouth. But those are all things you need to put to the side, and really get to the answers that you really want to know, which is this person qualified to care for you, and if so, what the plan is. And with that, I'll leave it there, and we'll continue on next month and I'll continue on with implants. Implants are a hot topic. I'll show more about some of the things we do after we place implants, which is really interesting too, at least to me. And a lot of patients ask about it, a lot of the pricing issues and stuff like that. I can talk about pricing and the insurances and stuff like that. So if anybody has any questions, you can ask.
There's one more question on the chat. I have an old partial that goes on the bottom of my mouth. Can I try to use it again? Because I need a new one for the top, and it does fit the top. It says, and it does fit the top at all, but they might be saying it doesn't fit the top at all.
Yeah. Typically what we do, if a person comes in to see me and they have existing dentures, I'm going to send them over to a prosthodontist, because I don't do dentures. I'll send them to somebody who does dentures to get them new dentures fabricated. Because if you had dentures for a while and you want to get some additional treatment, a lot of times I see that the dentures don't fit right. But a patient will say, well, I like them, they fit okay. And then you let this person, put implants in, and then the day you try to snap that denture into those implants, it doesn't fit correctly. Now you've spent several $1,000s when you tried to cut the cost on getting new dentures, and you in worse shape than you were previously. Or another situation is sometimes the dentures do fit. If the dentures do fit, I'm gonna tell the patient, why, if it ain't broke, don't fix it. Why try to do something in addition to when you have dentures that fit well? If they fit well, I'm gonna tell you, just leave it like it is. If you do have an issue with your denture, I'm gonna say we need to make brand new dentures. We need to start from scratch, because your bone changes. If you have dentures and no implants, a lot of times, when that bone remodels, you got those dentures sitting on that bone. It's gonna cause you to lose a little bit of bone. And so, every so often you need to get your dentures relined anyway. Where you go to your dentist and they put the material in there and refit them. Or if it gets, if you lose a lot of bone, we'll just make new dentures.
Good stuff.
Yeah.
Dr. Scott, I appreciate you, man. Once again, you informed us. This is our Dental Health Academy. And at Greater Bethel, we try to make sure that we minister to the whole person, and we use all the extraordinary gifts that God has given us within our membership and allow them to use their gift for the glory of God. And so we thank Dr. Scott, who is always available He'll be going a little bit higher. In addition to being a dentist, he'll be finishing up the periodontal school um, next month. And so we're just extremely grateful for all that you do for our community, and we look forward to seeing what God is going to do with you and your gifts, and also your gifted and anointed black queen that you have that sit next to your side. So thank you so much. Thank you everybody for joining us. Make sure you share the post. If no one has anything else to say, now to him who's able to keep us from falling, present us faultless before his presence with exceeded joy, to the only wise God, our Savior, be glory, majesty, dominion, and power, both now and forevermore. Have a great week.
All right.
Good job, Doc. All right.
All right. Thank you. Appreciate y'all. Y'all have a good night.
You too. Bye.